Welcome back to Whispers of the White House, where we dive deep into the individuals and institutions shaping America's future. I'm your host, Dr. Heather Wisdom, and today we're focusing on one of the most influential roles in the federal government, the Secretary of Health and Human Services, or HS. This department oversees critical public health policies, social services, and welfare programs that touch the lives of millions of Americans. In this episode, we'll examine the current Secretary, Xavier Becerra, and the incoming nominee, Robert Kennedy Jr. Let's not waste any time and jump right in. Let's begin with the current Secretary, Xavier Becerra. Born in Sacramento, California, Becerra earned his bachelor's degree in economics from Stanford University and his Juris Doctor from Stanford Law School. His career in public service began as a Deputy Attorney General in California before he served in the California State Assembly and later in Congress, representing California's 34th Congressional District for 12 terms. Becerra's legislative career was marked by his advocacy for healthcare reform, including his work defending the Affordable Care Act. His role as Attorney General of California brought him into national prominence as he led lawsuits against the Trump administration's attempts to dismantle the ACA. As Secretary of HHS under President Biden, Becerra has focused on expanding access to healthcare, addressing health disparities, and managing the COVID-19 pandemic. However, his tenure has not been without controversy. Critics have pointed to his lack of direct medical or public health experience as a potential shortcoming, particularly during a pandemic. Additionally, his handling of COVID-19 vaccine distribution faced early criticism for logistical delays and unclear communication strategies. Despite these challenges, Becerra has remained steadfast in his mission to preserve and expand healthcare access, earning praise from supporters for his commitment to equity in health policy. Now let's turn our attention to Robert F. Kennedy Jr., President-elect Donald Trump's nominee for Secretary of Health and Human Services. A scion of the Kennedy political dynasty, RFK Jr. brings a unique mix of environmental advocacy, legal experience, and deep controversy to the table. Born in 1954, Kennedy graduated from Harvard College and earned his law degree from the University of Virginia before completing a master's in environmental law at Pace University. Let's take a closer look at the accomplishments of Robert F. Kennedy Jr. Kennedy's career has been defined by his passionate advocacy for environmental protection and public health, as well as his efforts to hold corporations and governments accountable for their actions. He brings decades of experience as a litigator, environmentalist, and public speaker to the table, although his controversial views on vaccines have overshadowed much of his work in recent years. Kennedy first rose to prominence through his work as an environmental lawyer. He served with the Natural Resources Defense Council, NRDC, and founded the Waterkeeper Alliance, a global organization dedicated to protecting water resources. One of his most notable achievements was his leadership in restoring the Hudson River. Through legal battles and persistent advocacy, Kennedy played a central role in holding polluters accountable, resulting in significant improvements to the river's water quality and ecosystem. His efforts with the Riverkeeper organization became a model for grassroots environmental movements around the world. As the founder of the Waterkeeper Alliance, Kennedy expanded the fight for clean water globally. The organization now boasts over 300 waterkeeper programs in more than 40 countries, making it one of the most influential environmental advocacy networks in the world. Beyond water advocacy, Kennedy has been a dedicated supporter of renewable energy, framing the transition away from fossil fuels as both an economic imperative and a moral responsibility. His speeches and writings have inspired action, particularly among communities disproportionately affected by environmental harm. In addition to his work as an advocate, Kennedy is a prolific author and public speaker. His book, Crimes Against Nature, critiques corporate practices that harm the environment, while The Riverkeepers, co-authored with John Cronin, chronicles his efforts to protect the Hudson River. These works have cemented his reputation as a thought leader in environmental protection. Over the years, Kennedy has also been recognized with numerous awards, including the Green Cross International Environmental Leadership Award, highlighting his contributions to global environmental sustainability. So, what are his plans for the department? Well, he has outlined a series of ambitious changes he intends to implement, reflecting his long-standing critiques of federal health agencies and pharmaceutical industry practices. A central focus of Kennedy's agenda is a comprehensive overhaul of the Food and Drug Administration, FDA, revising dietary guidelines to reflect concerns about processed foods and industrial agriculture's impact on public health. He has expressed concerns about the agency's regulatory processes, particularly regarding vaccine approvals and pharmaceutical oversight. Kennedy advocates for increased transparency and has indicated plans to reassess the Prescription Drug User Fee Act, PDUFA, which allows the FDA to collect fees from drug manufacturers to fund the drug approval process. He argues that this system creates potential conflicts of interest and may compromise the agency's impartiality. By reforming these practices, Kennedy aims to reduce the pharmaceutical industry's influence over the FDA and ensure that public health interests are prioritized. At the Centers for Disease Control and Prevention, CDC, Kennedy intends to reevaluate public health policies, including the agency's stance on water fluoridation. Despite scientific consensus supporting the safety and dental health benefits of fluoride, Kennedy has raised concerns about its potential health risks. He plans to reverse current fluoride recommendations, a move that has sparked debate among public health experts. Additionally, Kennedy has highlighted the need for better pandemic preparedness, aiming to create clearer communication protocols and improve the transparency of decision-making during public health crises. He aims to establish an independent Vaccine Safety Review Board. This board would be separate from the CDC and FDA, tasked with independently evaluating vaccine safety and efficacy, as he has expressed concerns about the use of certain preservatives and additives in vaccines and medications, including thimerosal. He would also revisit vaccine mandates. Kennedy opposes widespread vaccine mandates and intends to promote policies that respect individual medical choice while ensuring public health. As a longtime environmental advocate, Kennedy aims to integrate environmental health into HHS policies by focusing on reducing exposure to pollutants such as pesticides, heavy metals, and endocrine-disrupting chemicals, particularly in vulnerable populations. As for the National Institutes of Health, NIH, Kennedy proposes a significant shift in funding priorities. He plans to reallocate a substantial portion of the agency's budget toward preventive and holistic health approaches, emphasizing lifestyle interventions and alternative therapies. Kennedy also advocates for stricter conflict of interest policies, aiming to prevent researchers with financial ties to the pharmaceutical industry from influencing public health recommendations. These proposed changes reflect his commitment to reducing the perceived influence of pharmaceutical companies on health research and policy. So he appears to be looking out for the betterment of the American public. Why is there such cause for alarm? Well, while Kennedy is widely celebrated for his environmental work, he is not without controversy. One notable example is his opposition to the Cape Wind Project, an offshore wind farm in Massachusetts. Despite being a strong advocate for renewable energy, Kennedy argued that the project would disrupt local fishing and harm the natural beauty of the area. Critics saw this stance as hypocritical and inconsistent with his environmental mission, accusing him of prioritizing personal interests over broader environmental goals. Kennedy has also been highly critical of government agencies and corporate practices, frequently accusing them of corruption and negligence in environmental matters. While his accusations have often highlighted real issues, some argue that his confrontational approach lacks nuance and alienates potential allies. He has been a vocal critic of vaccine safety and mandates, a position that has drawn significant criticism from the medical and scientific communities. Organizations like the World Health Organization and the CDC have labeled his views as misleading and potentially harmful to public health efforts. Critics argue that his rhetoric has contributed to vaccine hesitancy during the COVID-19 pandemic, exacerbating public health challenges. Despite these controversies, Trump's administration has touted Kennedy's willingness to challenge the status quo as a key strength. Supporters view him as a disruptor who could bring a fresh perspective to HHS, particularly in areas like public health transparency and environmental health policies. However, his critics worry that his controversial views on vaccines could undermine trust in the department at a time when public health credibility is more critical than ever. Perhaps he is best known for his outspoken views on vaccines, which have drawn widespread criticism from medical and scientific communities. For years, he has claimed that vaccines, particularly those containing the preservative thimerosal, are linked to autism. As chairman of the Children's Health Defense, Kennedy has amplified skepticism about vaccine safety. Critics argue that his rhetoric has fueled vaccine hesitancy, particularly during the COVID-19 pandemic. During the pandemic, Kennedy opposed lockdowns, mask mandates, and COVID-19 vaccines, claiming they were unsafe and accusing pharmaceutical companies of profiting at the expense of public health. Public health officials and social media platforms have labeled many of these statements as misinformation, citing robust data supporting the safety and efficacy of COVID-19 vaccines. In addition to his vaccine skepticism, Kennedy has been associated with other conspiracy theories, particularly around public health and technology. He has raised concerns about the potential health risks of 5G wireless networks, despite a lack of credible scientific evidence linking 5G to harm. These claims have further fueled criticism that Kennedy is spreading misinformation and fear. Kennedy's polarizing views have often overshadowed his accomplishments, particularly in environmental law and advocacy. While his supporters see him as a brave truth-teller challenging entrenched systems, his critics worry that his rhetoric undermines public trust in science and health institutions. Robert F. Kennedy Jr. is a complex figure, a man whose passionate advocacy for environmental justice stands alongside deeply controversial and divisive positions on vaccines and public health. As he steps into the national spotlight with his nomination for Secretary of Health and Human Services, these controversies will no doubt continue to spark intense debate about his vision and suitability for such a critical role. So how do Xavier Becerra and Robert Kennedy Jr. compare? At first glance, their profiles couldn't be more different. Becerra is a seasoned politician with extensive legal and policy experience, but no medical background. Kennedy, on the other hand, is a passionate advocate with a history of environmental leadership, but carries significant baggage due to his vaccine skepticism. Becerra's supporters praise his deep understanding of healthcare law and his ability to navigate complex policy challenges, particularly in expanding access to care. However, his detractors argue that his lack of direct experience in medicine or public health has limited his effectiveness during crises like the COVID-19 pandemic. Kennedy's supporters point to his decades of advocacy and his bold willingness to challenge institutional norms. They argue that his focus on environmental health could bring a new dimension to HHS's leadership. However, his critics highlight the dangers of appointing someone with a history of promoting controversial and scientifically unsupported views about vaccines. These controversies could erode trust in public health initiatives and complicate efforts to address ongoing health crises. Ultimately, this comparison raises a fundamental question. Should the Secretary of HHS be a steady, policy-driven leader or a bold disruptor willing to challenge the system? And can either approach effectively navigate the immense challenges facing public health today? The Secretary of Health and Human Services plays a critical role in shaping the health and well-being of every American. Whether it's responding to pandemics, reforming healthcare, or addressing environmental health issues, this position demands expertise, vision, and a commitment to public trust. Xavier Becerra and Robert Kennedy Jr. represent two vastly different leadership styles, one grounded in policy and law, the other marked by advocacy and disruption, which is not necessarily a bad thing. As the nation faces unprecedented public health challenges, the stakes for this nomination couldn't be higher. Will the next secretary rise to the occasion, or will their leadership deepen the divides in public health policy? Only time will tell. Well, thank you for joining me on this episode of Whispers of the White House. Don't forget to subscribe and share your thoughts on today's discussion. In our next episode, we'll explore the Department of Energy, where the battle between fossil fuels, renewable energy, and climate policy is set to shape the future of America's energy independence. Until then, stay informed, stay engaged, and as always, stay wise.